Hello, and welcome to another episode of Spotlight on Health. I'm your host, Dr. Stephen Eschnauer, the health officer at the Kanawha-Charleston Health Department. And with me today, I have a very special guest, Elizabeth Adkins from the Cabell-Huntington Health Department. She is the administrator there and has been there how many total years at Cabell-Huntington?
17 years.
17 years. So today we're going to talk a little bit about a sister health department in Cabell County and also talk about local health here in West Virginia. So Elizabeth, welcome to the show.
Thank you. Thank you for having me.
So tell us a little bit about yourself, how you ended up in public health.
So public health is definitely something that was new to me when I first started in this position. I went to WVU for my undergrad, and I have a communications major with a business administration minor. And then I went to Marshall University for my master's degree, and that is in healthcare administration. And it was through that program that I learned about an open position at the Cabell-Huntington Health Department. So I have been there ever since.
Ever since, 17 years later, yes. Yes. And coming from Huntington, that was like being at home.
Yes, yes, it was definitely familiar, so it was nice to be back there.
And when you started out at the health department, what position, what jobs, responsibilities did you have?
Sure. So I started out as a public health educator. So it was a great position for me because I got to learn all about public health and all the different programs and services that we are able to offer the community and educate the community about how to better protect themselves to live a healthy life. So that was my first role there. Mm-hmm.
And now you're the administrator.
Yes, now I am the administrator. I have been in administration for the past couple of years. So
tell me a little bit about the responsibility of what an administrator of a local health department does.
Sure. So the local health administrator will oversee the day-to-day operations. So making sure that the building is up to par with keeping everything in line to be safe for the community and our staff. It's overseeing the clinical operations with our direct contact with our director of nursing, also our environmental health and our administrative team. So just the oversight to make sure that everything runs smoothly each day for the community.
Yeah, well, good. Yeah, it's been interesting being in public health.
Sure.
Myself, having only been in this position for the last couple of years, it's been a steep learning curve, and I'm a little envious of the amount of time that you've had to kind of develop yourself in a.
Sure.
So that is good because it really helped probably prepare you for all the different roles of an administrator with the staff. And how big is the Cabell-Huntington Health Department? How many staff do you have?
We have 41 staff, so we are one of the larger health departments within the state. We are accredited, which is wonderful. We received public health accreditation 5 years ago, and we are currently working on our reaccreditation.
Good luck with that. As you know, Kanawha-Charleston Health Department is also accredited,
yes.
And we are going through the process of that reaccreditation, and it is a lot of work. But
it's a lot of work. It's lengthy, but it's great team development for us. We have an accreditation team that works together each week to go over the domains and the different objectives that need to be completed in order to apply for reaccreditation. Definitely a lot of work.
Oh yes, oh yes.
As you know.
Yes. Oh yes. So what are some of the newer exciting things that are happening at your department that you see for 2024 and beyond now that we are leaving the COVID department era and
right.
kind of getting back into being a full-service health department era?
Right. So, coming out of the COVID-19 pandemic has been a transition for our staff. Mm-hmm. We have a lot of new staff, which is exciting for us. So it's providing opportunities to develop them either through trainings and workshops in their specialty. We are also looking at other financial ways to sustain a lot of our programs. So we are looking for grants. We recently just received the NEHAW grant for our environmental team to work on. So that's like an environmental accreditation. So
nice.
We're really going through 2 accreditations at the same time, which is exciting, but also a lot of work out of our staff. So, but we are all dedicated to making the community the best that we can, and that's through looking at ways to sustain our programs, to make them better, and bring more funding into the county.
No, that's good. That's good. So in this position, you're obviously very dedicated in the day-to-day operations of the local health department, but you also serve in a much greater role with the local health association. So how long have you been really associated or working with the local health association?
So I have been with the association for the past, I would say, 5 to 6 years. When I first came on, I was serving as the delegate for the health department. So the local health association, each health department has a delegate that's been appointed. So I have been serving as our delegate for the past 5 or 6 years. And then in 2019 into 2020, I was actually serving on the executive council as an member at large. So that was very exciting for me to be on that level, to see how the operations of the association work. And then after that, I just remained a delegate. And then this past year, I served as the vice president. And January 1 of 2024, I am now the president of the association. So
yes. And
it's very exciting. Thank you.
It is very exciting. And I was very glad to see you ascend into that position with your tenure and experience and coming from an accredited department and really having a passion to promote public health across our state, because not all counties have a large health department. So as you think about your new position as the president, where do you see some of the opportunities, we'll use that term, opportunities, to work with our other counties within the state to improve the overall health of West Virginians?
I think with this position for me, it's a great opportunity to enhance what we have to offer to each other as health departments. We have a great opportunity to network with each other, to share resources as needed. One of the visions and missions we have within the association is a unified message. It's so important to have consistent messaging across the state of West Virginia when it comes to health education. It's important that we're all sharing that same message and delivering that to our communities, so it doesn't cause confusion regarding, immunizations or environmental. So that's one area that I think is a great way for us as an association to build and to grow and improve that every year by working together.
Yeah, I love that saying, many voices, one message, because we are all West Virginians, and having one standard, one message, one mission to improve the health of West Virginians. We all need to be on that same sheet of music.
Yes. It helps so much when, somebody who lives in Cabell County also hears the same message, on another area of the state that they're visiting. So it's helpful to have that consistency, that credibility for, all of our counties there to share.
So tell me a little bit about your region that the Cabell-Huntington Health Department is in, being a different region from what Kanawha County is in.
Sure. So Cabell County falls in the Bundle Team region, which is 9 counties in the southern part of the state. So that includes Wayne County, Lincoln and Logan, Mason, Mingo, Wayne, and Boone County, and Jackson. Forgot about Jackson. So we have a bundle region. We work very closely together. We have threat preparedness meetings once a month where we come together and work on different goals and making sure that we have the tools and the resources to respond to emergencies, disasters as they would occur in our county. We call upon each other if we need help, assistance. Not only in an emergency situation, but a day-to-day, we can assist other health departments within our region to provide support as needed.
Yeah, that's good. There's, I think, been a lot of pressure or resistance, I should say, to quote-unquote regionalization, and I hate to use that term, but it's, I'm not sure how else to describe it, but I do see an opportunity for the counties to work much closer together within their fellow or sister counties to help each other, because some of these departments are very small.
They are. They're very small. Some of our health departments only have 3 to 4 full-time staff. So when I look at our health department, we are very blessed with 41 employees. 38 of them are full-time. So that's a lot to make things work within our county. So we look at other counties that may not have those resources. So again, another benefit to working together as a region to help provide services that they may not be able to get without assistance We work very closely with Wayne County Health Department. They are a smaller county within West Virginia, so it's wonderful to be able to help assist them with different projects that we've done in the past.
Yeah, having attended the local health association meetings, it is good to see the counties want to work together
Yes.
and to collaborate and try to raise the bar for all West Virginians and provide
Absolutely.
equal services, whether you live in a very rural county or you live in a much more developed or populated county.
Absolutely. That's one of the main benefits of the association. We have monthly meetings. We come together, each health department sends their delegate, and that's a time for us to train together, share what needs are there. We can assess our communities and see what we can ask of each other for help. They may need help with a certain program, and someone could say, I've already done that. I can help assist you and guide you. And again, it's just another great benefit of the association to have those connections. So when you go back to your office, you know who to contact when you need help with something.
Yeah. So with the local health association, a big important part of it is communication. That's probably the one of the biggest things that we do, but other areas where you can see some opportunity within the association. What are some of your thoughts?
I think public policy is definitely one that we can come together. Tomorrow we are all going to be at the legislature. It's Public Health Day. So again, another opportunity for us to provide education about all of our public health services. And there are laws that, affect public health. And I think it's important that we provide education on the benefits of those and why, we have these laws in place to protect people. It's just a lot of opportunity there for us to provide because the future relies on policies and having strong policies that will benefit public health.
Absolutely. It is so essential. When we look at some of the success of West Virginia and having been reviewing some of the policies that have changed in other states and what the consequences were. Just this year, for instance, we've already had 4 states who've had measles outbreaks. And there were a number of states last year, over 20, that had measles outbreaks last year. And West Virginia has not had one since 2009.
I know.
And that's a testament to great policies that we have here in West Virginia to protect West Virginians, especially our children that are at most susceptible and at risk. There's always a lot of debate each year, it seems, on our policies that we have here in West Virginia, and having that many voices, one message is so important to maintain the policies that we know work and that are good.
Absolutely.
And then look at addressing, improving, or updating other policies that may not be as current, because some laws were written many years ago.
Sure.
So it is a constant review as we try to improve our services and improve the health across West Virginia.
Absolutely.
So communication, policy, what are other areas?
I think funding is one that we need to be mindful of and think about. You all have to have funding to support local health departments, and I think that's something that we as local health administrators look at to see what are those opportunities that we have for us. We have this year a CDC infrastructure grant which helps support staffing and retaining staff. We have to have good staff in place and able to provide these services and programs to the community. But how are you going to sustain them? So, looking ahead, you have to have those things in line in order to support, good sustainability projects. So I think funding is something that as an association we need to look at and be mindful of, make sure we are looking at those opportunities, different grants that could be available to us and go after those and spend that time working on ways to develop other programs, for example, that we could get more funding in.
Oh. It is very interesting that we are one state with many health departments, yet we have different models for funding. We have counties, most all the counties receive some certain amounts of state funding.
State aid.
Some receive some funding from their county commissions. Some receive some from cities.
Right.
And some do not. Others have levies that help fund the health departments. But what I've noticed is that there's a lot of dissimilarity and different amounts of funding for different departments, and it sometimes it creates. I heard someone say haves and have-nots.
Yeah.
And we do really see that in some of the unfunded or underfunded, I should say, not unfunded, underfunded departments. And so, yeah, I could see where funding from the position of the president it's very important, and how we sustain funding versus a grant that just runs out in a couple of years. And then how do you keep your employees, your services, and deliver what your community needs?
Absolutely. Those are definitely things to keep on our horizon and continue to work towards. It's so important for us to move forward within public health.
Oh, absolutely.
Yeah.
Absolutely. Any other ideas for the association moving forward as far as ideas of communication, funding, and policy?
A little bit more on the communication. I have always been a huge component of looking at our communication channels. Many of us share the same media markets, for example, and I think it's important to look at what resources we have for communicating. Social media is a huge tool that we utilize every day at our health department. We are on Facebook, Twitter, and Instagram, and you have to move with the culture and the trends of how to reach people. And I think that sharing those resources with other health departments can help them to build their programs and services. So I think that it's important that we look at a regional communication plan for each other to help. We have a full-time public information officer. I know you all also have a public information officer, but not every health department has that resource. So being able to share those resources with each other is very important, and it's helpful to share a press release with someone if they are experiencing an outbreak of some sort. Just to have those resources in place in a central location to access, I think, is important. And those are things we've talked about before at association meetings.
Yeah, I firmly agree. It's not just the message, but how we get those messages out and share our PIOs that may jointly develop a lot of the actual messages for the different media, whether it be Facebook, Twitter, Instagram, and also I'm sure it's the same in Cabell, that the health officer may end up being in the news on a regular basis, either in print press or on TV or radio. And taking advantage of a common message and sharing this as if it's going to multiple counties, not just their immediate market.
Absolutely. For example, when we send out a press release, it hits, our 10 to 12 counties that are closest to us, which is wonderful. So sharing that with them ahead of time is helpful to give them a heads up. Dr. Michael Kilkenny is our CEO and health officer and our spokesperson for our health department. And it's just a great resource to have him and let our region, for example, be able to have access to that communication. And that helps information going to Cabell County, but also to the other counties. So it's not just, housed right there. So it's nice to be able to share our communication network.
One of the things that I learned coming into this position is that there are very few full-time health officers in the state.
Right.
Yes, right now there are four.
There are four
that I know of. At the moment.
At the moment, yes.
So it is a limited resource, and it was one of those areas of opportunity, I believe, as well, to share access. It doesn't mean that they wouldn't necessarily be the health officer for another health department, but being able to access a full-time public health officer anytime Monday through Friday, and I've tried to avail myself, and I know Dr. Kilkenny has, and I know Dr. Smith has, Dr. Stewart has, to avail themselves, to be available to anybody, to reach out to them, call them, you have questions, concerns. And that was another area of sharing, because most counties, it's not feasible for them to have a full-time health officer.
Right, and having that access, and like you said, being available to other health departments is a huge benefit. And then just having that calmness for a local administrator to say, I know who to call, in my region, And it just having that availability and access is a huge benefit.
One of the opportunities that I've noticed that we have been working on at the local health level is trying to present a model for commonality of all the different regional maps.
Right.
That there were so many different regional maps that related to threat preparedness.
Right.
Well, you can,
Epidemiology, yeah.
Yes.
Those were fun conversations.
Yes. And how and why it's important that we all try to get on the same sheet of music so that you start working in the same regional team across many areas of communication, not just, well, we only work with them for threat preparedness and we only work with this
Right.
county for epidemiology. What are some of your thoughts on how we become more team-like?
I think there's a lot of opportunity to look at the regions and make sure that, you have access for what you're working on, whether it's threat prep, whether it's epidemiology, whether it's nursing. And it makes most sense that it's, all together there versus separating. And so I think there is work still to be done in order to define, those lines of what region we're going to go in and be with, and not hurt anybody's feelings, but over time it just works well when you're not having to switch your counterparts or your contacts in a certain county and region, to have it more familiar for each person to know who to contact, and there's not that confusion of, oh no, that's for epi or that's for threat prep. This just will align it and make it easier way for everybody to access and get timely information.
I've noticed that it seems like, from a new person's perspective, meaning new as in only having been in the position a couple of years, that we've seen a significant improvement in communication between the state and the local health to come together in mission, in direction, in communication, and collaboration. So you've been around the association for a while, and I've heard that in the past it wasn't always as friendly and collaborative. And how and why you saw it change to the improved state that we're seeing today?
I think this is a really good subject. I'm all about communication. I think it's very important to have open lines of communication with state and local, and we definitely have that. We are moving with that into a stronger side, which is great. We have the Center for Local Health, where we have a direct contact where we can reach out as an administrator, to contact them regarding any issues that our health department may be facing. So having that is wonderful and a huge resource, and there's not this, oh, I don't know who to contact at the state. So I think having those open lines of communication has been welcomed by the state. We work very closely with Dr. Christensen, the association does, and he's a huge support of our association and our work that we do. He wants to hear from us, and he will come to our meetings. He's also joining us tomorrow at the legislature. So I think it's really important to continue to have opportunities like that to improve communication. I know you and I both serve on the Public Health Advisory Council with Dr. Christensen, and also other county commissioners throughout the state. So again, those are opportunities that were not always there, and we have these now to be able to continue to grow and bring forth different projects that we can make better for our counties and our state.
Yes. It seems like over the last few years, at the legislative level, there's been a lot of focus on DHHR and health services efficiencies, and they've forced DHHR to split into three different entities. Do you see that affecting the local health agencies, or do you probably see that as, from our level at local health, not really changing much?
As of right now, I don't see a lot changing from our side of that. I think, with that split, there's always, time for, transition and learning of new roles. But as of right now, I don't see any direct impact on public health.
That's good. That's good. Because we do want to continue to work, obviously, very well with the state, and it has been excellent working with Debbie Hissom at the Center for Local Health and Dr. Matt Christensen. It is nice to work with people that want to communicate and want to collaborate and want to listen and learn, and I found it to be very encouraging and enlightening because I'm learning from them and they're learning from us at the local health levels. And it's really good to see government working the way it should work and not see infighting or areas where they're just not working well at all together. So I think this is a very positive time for local health.
It is very positive.
And that we have an opportunity, and that opportunity is also to kind of create our own destiny here. As all these agencies working with one common message and one common goal of improving health of West Virginians. Absolutely.
And having open communication is the best way to start with that. And we certainly are on the right track to do that.
Oh, absolutely, absolutely. So any other things that you want to bring up here at the close of the show? Any thoughts on public health or the future?
Public health is something that is very near and dear to my heart. I tell anyone who I come in contact with, whether it's a community member, a family member, or a friend, your local health department is serving you, whether you have ever been there or not. You may not even know what all the health department does, and really until you start to get more involved and learn about it, then you won't know. But public health is certainly something that is so important to a local community. It keeps that community safe. There's standards in place for all the community to come together to live and work and have a safe environment. So I just like to say that public health is here. We're here to stay, and it's definitely something that if you're not aware of it, it's something to become aware of. And know about and how it can serve you.
Yes, public health is about the people. It's about you, the citizens, our listeners, about keeping you safe, providing a disease-free environment, and providing a food that is safe when you go out to dine at a restaurant. Yes.
So someone says, I don't really know much about it. They don't do much. Well, if you go out to eat, if you go to the grocery store, if your kids are in school and in daycare, we are serving you every single day, and we are committed to that. So.
Well, Elizabeth, thank you very much for joining our show. Elizabeth Atkins from the Cabell-Huntington Health Department. Thank you very much, and we look forward to working together on many days to come.
Yes, thank you for having me. I appreciate it.
Thank you.